When you arrive for your CT scan with contrast, you will be greeted by a nurse. If your test involves an IV, the nurse will insert this before your test. Your CT scan is a way of taking many X-ray pictures of your body from different directions. A computer puts the pictures together to let the doctor see bones, blood vessels, and organs. Most patients do not need to remove any clothing for the scan. However, you may be asked to change into a gown or remove some clothing depending on the part of your body being scanned. Your CT scan will use a special dye called contrast. The contrast will move throughout your body in your blood. The contrast will allow doctors to see inside your body. You will take the contrast by drinking a liquid, or you will have the contrast inserted into your blood using an IV. After your IV is inserted, you will talk to the technologist about what will happen during your test. The technologist will answer any questions you have. The technologist will also ask you to take off things that might affect the image, like glasses, watches, and jewelry in the area that is being scanned. The technologist will ask you to lie down on a table for the scan. The table will move in and out of the scanner as it takes pictures. The scanner looks like a large donut. Unless your scan involved drinking contrast, the technologist will inject the dye using the IV line inserted by the nurse. The technologist will go into a different room to run the test. They will still be able to see and hear you using a microphone. You will be able to let the technologist know if you need anything or feel uncomfortable during the scan. A CT scan usually takes 15 to 20 minutes for each part of the body being scanned. It may take longer depending on the part of your body. You should ask the technologist how long your scan will take. At the end of your scan, the technologist will help you off the table. If you wore a gown, you can change into your clothes at this time. Remember to collect any items you may have removed during the test, like your glasses or jewelry. Be sure to ask any other questions you have about the test before leaving.
Hello everyone, good evening to all. So today we have Amirah Jamil to present about bismuth particle as a contrast agent in CT scan. As we all know that Amirah Jamil is a PhD candidate from medical radiation program. So here, Amirah Jamil, are you ready?
Ready.
Okay, so we start now. Okay, I pass this for you.
Okay, thank you
Okay.
so much. So I hope everyone can see my slide. Can everyone see my slide? When Shafa, is my slide opening?
Oh yes, open it. Nampak je.
Hello, Assalamualaikum and greetings to all. Today I will explain and present to you a part of my research entitled Bismuth particles as contrast agent in CT scan. Okay, this is a table of content. For introduction, we will talk about CT imaging mechanism and what is contrast agent, and we will introduce to you about metallic nanoparticles. And we will go to the materials and method after that. We will talk about Bismuth nanoparticles or BINPs synthesis, cell culture, cytotoxicity assay, ROS production, which is reactive oxygen species, and CT irradiation. Then we will continue to the results and discussion, and then we will conclude our the research in the end. So for introduction, CT mechanism. So CT is derived from a Greek language, from tomos, that means slice, and then graphene, that means draw. So the idea of using tomography as a diagnostic tool in medicine was adopted soon after the discovery of X-ray by W.C. Röntgen in 1895. So a CT image is obtained by rotating an X-ray source around the object or the patient with a detector positioned directly opposite to the radiation source. And operating voltage of CT scan usually falls between 80 kVp to 150 kVp. So this is a diagram or an illustration of non-contrast image and contrast image. The left side is non-contrast image, and the right side is contrast image of an abdomen. So with a few exceptions, usually assessment of acute intracranial pathology, interstitial lung disease, fracture, and renal tract calculi, the majority of CT scan are performed following the administration of iodinated contrast medium. So when injected intravenously, contrast increases the density of blood vessels and organs. So as a consequence, lymph node can be easily distinguished from blood vessel, and abdominal lesions in solid organ and become easier to distinguish from normal surrounding parenchyma. So the conclusion is, when the contrast cannot be given to the patient, usually, for example, patient with contrast allergy or renal impairment, our ability to interpret CT scan for certain pathological process is severely affected. From this image, how do you know that the patient is given contrast? This is, if you can see the arrow, the cursor, this is the descending aorta. So it is not enhanced during non-contrast imaging. But after we injected the patient with contrast, the descending aorta is enhanced. And also, if you can see from the left side, the left diagram, you cannot see any pathological area. It's just this one is your liver, but you cannot see it because there's no contrast being introduced. After we introduce contrast, we can see the lesions or pathological areas around the liver. So what is contrast agent? Usually, as a rule, materials possessing higher density or high atomic number Z tend to better absorb X-ray. Commercialized contrast media, which is iodine, has Z number of 53, thus absorb X-ray and could differentiate normal tissue and pathological condition due to high vascularity in abnormal tissue. So even though iodinated contrast media is biologically safe, the side effect could range from acute to life-threatening. Some of the adverse reactions include rashes, skin flushing, nausea, vomiting, accumulation of fluid in face, larynx, and blood vessel, and bronchospasm in patient with history of asthma and cardiac failure. So iodinated contrast media may also induce thyroid dysfunction by developing hyper or hypothyroidism due to free iodide ions when prepping the contrast media. Plus, overdue storage of the contrast and exposure to light lead to deterioration of chemicals in contrast media, resulting in free iodide ions. Plus, iodine load when administering the contrast media is frequently higher, which is hundreds of thousands of times than recommended intake of iodine daily, which is 150 microgram. And the administration of contrast media in patients diagnosed with diabetes may lead to worsening of kidney impairment or contrast-induced nephropathy. So with metallic nanoparticles such as gold, platinum, and bismuth, it was introduced decades ago, and the Z numbers of gold is 79, platinum is 78, and bismuth is 83. So like I said, as a rule, materials possessing higher density or high atomic number Z will tend to better absorb X-ray and then at the same time increase the visuality or increase the contrast enhancement in the image. So theoretically, bismuth nanoparticles would yield higher contrast enhancement in CT images than iodine because bismuth has higher Z number than iodine. So these are our objective. Objective 1 is to evaluate the cytotoxicity of bismuth nanoparticles. And
Amirah Jamil, audience said that they cannot see the next slide. Any technical issues regarding about that? Oh, alright. Okay. Oh, use masih dekat slide pertama ke tadi?
tak.
Oh.
Wait.
Okay.
Let me hide for a bit. Wait.
Okay.
Share screen.
Just wait guys. Sekejap. Biasalah ada technical issue macam biasa.
Can everyone see now? If I press next.
Okay.
Is
Clear.
it okay? Okay. Thank you so much.
Alright.
So where were we? Objectives, right? So the objective 1 is to evaluate cytotoxicity of bismuth nanoparticles, which is BINPs for short. And objective 2 is to investigate the contrast enhancement of bismuth nanoparticles. These are the materials and method. First, we will synthesize the bismuth nanoparticles, and then we go to cell culture, and then cytotoxicity assay. Then we will investigate the ROS production, and then we will continue with CT irradiation. So for bismuth nanoparticles synthesization, we can see the diagram here. So the materials are as follow. The first chemical reaction produce yellow solution, and then it'll be milky white solution, and then when we expose or subjected the chemicals to hydrothermal method at 160 Celsius for 8 hours, it will result in black suspension, and resulted black suspension is washed using distilled water and then ethanol, and then we will dry it until it is producing a black powder. So for cell culture, we use HFOB, which is human fetal osteoblast cell, and NCF7 cells, which is human mammary carcinoma. It is cultured in DMEM and supplemented with 10% fetal bovine serum and 1% penicillin streptomycin. And the cells were incubated under 37 Celsius temperature and humidified with 5% CO2 to grow. PBS is used to wash out excess debris, and routine passaging every 48 to 72 hours to subdivide and the cells into fresh medium were done by detaching adherent cells with adequate trypsin EDTA. For cytotoxicity assay, the cell lines cultured in flask are trypsinized, and each cell lines are seeded into 96 well plates and then left to grow until it's achieve 70% confluency, and all of the sample were treated with different concentration of bismuth nanoparticles with control left without bismuth nanoparticles, and samples were left within 24, 48, and 72 hours before washed with PBS and incubated with 10 microliter of Presto Blue for an hour. And the fluorescence measurement of samples was read using 535 nanometer excitation and 615 nanometer 615 emission for 1 to 4 hours. So for ROS production post bismuth nanoparticles treatment, the same amount of cells were cultured in 96 well plates until 70% confluency is achieved. And then samples are washed with PBS and treated with DCFDA cellular ROS assay kit reagent and incubated for an hour, wrapped in aluminum foil. And then the sample are rinsed with PBS and were treated with different concentration of bismuth, with control group is left without bismuth nanoparticles. And the fluorescent measurement is read using 485 excitation and 520 emission at 0, 1, 2, 3, 4, 5, and 24 hours. So for the CT irradiation, the tube potential, which is KVP, exposure variation, is 80, 100, 100, 120, and 140 kbp. That is the tube potential that we use. And then using coronal plane images, variables to measure is HU, CNR, and SNR in each sample areas. The ROI, which is region of interest of 16 plus minus 1 mm, was drawn manually to image the bismuth nanoparticles, VCPAC, which is the iodine that we use, to compare between bismuth and iodine, and H2O samples to acquire the HU numbers. And the ROI of air and air phantom backgrounds were also recorded for further calculation of SNR and CNR. But today I will only talk about the HU. What is HU? It is the method of measurement to see the contrast enhancement. The higher the HU, the more higher the contrast enhancement. This for result and discussion, this is the cytotoxicity assay. So MCF7, the left one, and the HFOB at the right figure. MCF7 cells shows that using 0.5 millimole of bismuth nanoparticles concentration was slightly lowered in cell viability after 48 hours of treatment with 60 nanometer bismuth nanoparticles. Though the cell viability was decreased after 48 hours, the percentage of cell count was still more than 80%, which is within the acceptable range. After 72 hours of treatment, the MCF7 cell viability appeared to be raised. This shows that after 48 hours, the cell treated with 0.5 millimole bismuth nanoparticles has started to lose the toxicity effect and begins to proliferate and multiply. For HFOB, the right hand side of the figure, bismuth nanoparticles became slightly toxic to the HFOB cells at concentration of 0.5 millimole after 72 hours of treatment, with the cell viability is marked to be approximately 48%. No, 64%, sorry. It is clear that 0.5 millimole bismuth nanoparticles is cytotoxic to the HFOB cells. However, it is concluded that using 0.05 and 0.0005 millimole, the HFOB cells were less sensitive to the bismuth nanoparticles and proliferates and multiply over time, marked by increase of cell viability from 24 hours to 72 hours post-treatment of bismuth nanoparticles. So for ROS production, the result shows that using different concentration, there is no damage is inflicted to the cells via administration of bismuth nanoparticles, which concluded that ROS is not dependent on contrast of the the concentration of bismuth nanoparticles. In addition to less ROS, the ROS is lowered after 24 hours, which is explained that non-toxic result in MCF7 cytotoxicity assay just now after 24, 48, and 72 hours. On the contrary, for HFOB, ROS in HFOB after 24 hours is increased compared to 0 hours to 5 hours. This could explain the cytotoxicity that BINPs or bismuth nanoparticles has inflicted to the HFOB cells after 72 hours when using 0.5 millimole bismuth concentration. While ROS is not dependent on bismuth concentration, it is concluded that ROS is time dependent. Based on the figure, it is valid to say that the cytotoxicity of bismuth nanoparticles on the HFOB cell lines might be caused by ROS production. So this is the contrast enhancement of control cells, iodine plus cells, bismuth nanoparticles plus cell, and bismuth pack encapsulated with cells. So for contrast enhancement of all samples, it appears to be lowered over time, except for bismuth with pack at 100 kbp, and for bismuth and cells in 120 kbp. So the contrast enhancement is dependent on tube voltage and shows that with increased kbp, HU of samples is lowered. This might due to increased X-ray penetration power. The figure depicted that higher kbp would yield in lower subject contrast, which is in line theoretically with mechanism of X-ray penetration and attenuation coefficient in the subject contrast, which means the more higher you put the tube voltage, the higher the tube voltage, the lower the contrast will be. So the conclusion is, conclusion 1, bismuth is non-toxic to HFOB and MCF7 cell after 48 hours post-treatment, and the cytotoxicity is time dependent. And then conclusion 2 is that bismuth nanoparticles contrast enhancement is greater than iodine up to 7-folds and dependent on the tube potential. These are the reference, and this is my publication and presentations. Thank you so much.
Okay. So guys, ada question for Miss Amirah Jamil? So kalau ada soalan, boleh drop dekat bahagian komen.
Can I see the comments? No?
No, when they comment, I will pop up on the screen. I will show it on the screen. Okay, we have question now. All right, Miss Amirah Jamil. Can you see it?
Creation of contrast particles is easy and cost-effective. Any concerns of unexpected side effect of this contrast agent? So, It is easy and cost effective. It is not using high or expensive materials. Any concern of unexpected side effect of this contrast agent? The concern is when we want to use this contrast agent using MRI, because MRI you cannot use metal. You cannot even have metal objects with you when you enter the MRI room. So that is one concern. And other concern is the since it is nanometer, we don't know if it could pass through liver for toxin removal, or it could pass through kidney. So we don't know that. But from other research, they said that even micrometer, yes, even micrometer can pass through liver. Yeah, that's it. Second question, is bismuth is gem? Is bismuth is gem as it appears rainbow crystal color? Uh, uh, no, because bismuth is usually black in color, especially if it's pure. So it is black in color. See. Next, is there any next question? Is bismuth the best as contrast agent, or is it other potential contenders? Yes, we have other potential contenders, especially if their Z number is higher than bismuth. The problem is with bismuth, it's too high of a Z number compared to gold, platinum, and etc. So you don't want too high of a bismuth, too high of a Z number also, because it could result in striking effect in CT imaging or any X-ray imaging. So I feel like bismuth is not too high and not too low of materials to be used as contrast agent. Is there any more questions? Why did I use HFOB? Because it's um, to evaluate the cell cytotoxicity when using cancer cell and then normal cell. So as you can see, for cancer cell MCF7, it is less toxic or non-toxic at all, with 80% 80% cell viability at least. But for HFOB, for the normal cells, we can see that it is slightly toxic when we use higher concentration. So that's why we want to see the correlation between, or the effect of bismuth nanoparticles in HFOB, which is normal cells, and cancer cells, which is MCF7. Any other questions? Is bismuth toxic to human, especially kids? Actually, bismuth or any material is toxic in large amount, but since we are using millimole concentration, it is not as toxic, and it is actually biodegradable. And bismuth actually has the appropriate amount of bismuth has healing properties. So usually there is bismuth content in any like antiseptic products. So it is not toxic to kids, but any materials in a large load or in a large amount can be toxic. But this one we just use a small amount of millimole like the highest is 0.05 millimole, which is not toxic, at least after 48 hours of introduction of bismuth nanoparticles to the cells. Next questions. Is bismuth agent showed induce morphological change of organs such as heart, liver, kidney, lung, and spleen? It doesn't for um, for contrast agent, it doesn't induce any morphological changes of organ. It only shows contrast enhancement uh, within the blood vessels, because pathological areas or pathological condition, for example, liver cirrhosis, the pathological area of, for example, a mass has high vascularity. That's why when we introduce bismuth or any contrast agent through the blood vessels, the contrast agent or the dye would increase the contrast enhancement within the mass or within the vascularized tumor, for example. So it doesn't change anything. It doesn't change morphological of the organ. What it does is merely increase the contrast enhancement towards pathological areas. Any other question? Mind to share your research journey about this study? It's slowly progressing because right now I already done for CT scan only. My part of my research would include mammography and MRI. That's why I use MCF7, human memory carcinoma. So right now it is slowly progressing. That's why this part of research includes CT scan, mammography, and MRI. So I am slowly progressing towards finishing this part of the research. Next up.
So Amirah Jamil, apa yang membuatkan anda berminat untuk melakukan research pasal bismuth particle ni? Sebab kita ada banyak potential candidate dalam predictable tu untuk CT scan. Tapi kenapa anda pilih bismuth particle sebagai potential candidate untuk contrast agent ni? Is there any story about that?
So far, in the metal component in periodic table, bismuth is one of the highest Z number. So that's why I am interested to check if it is compatible in CT scan, MRI, and mammography. Yeah, that's why, because of the Z number of the bismuth nanoparticles.
Oh, I see. So what is your biggest concern about this study? Your biggest concern?
My biggest concern is whether it is toxic, which is already discussed. And then whether it is, if we finally can inject the patient with bismuth nanoparticles as contrast agent, whether the kidney could handle it, or excrete it through urine, or maybe it could stuck in the liver system. But so far as I read, even micrometer of nanoparticles could be excreted from liver and then from kidney. So it is actually a suitable candidate for contrast agent. Mm.
Oh, I see. So other than for CT scanning in clinical application, what is the next best? Macam selain daripada CT scanning, apa lagi yang kita boleh guna untuk bismuth particle ni?
I would like to see the healing healing properties of particles.
Okay.
I feel like it is not only in medical imaging field. It's supposed to be introduced to any others like beauty products and stuff because it is healing. The bismuth particles is healing to the skin.
Really?
Yeah, there are some research about bismuth oxide that it could heal patient with scarring due to removal of breast cancer.
Oh,
So
I see. Interesting.
yeah, I guess instead of not instead rather apart from medical imaging, I feel like it is suitable. Bismuth nanoparticles is suitable for any other field also.
Okay, we have another question by Nasuha.
Mm-hmm.
Okay.
Is it
bismuth
bismuth
already
already applied in clinical study? It isn't. The only nanoparticles that already being used as contrast agent is gold nanoparticles. It is called AUROVIST, AUROVIST. So most research using bismuth is still in vitro and in vivo as for now.
Oh. So, Amirah Jamil, sebelum you introduce bismuth particle to human, you ada apply pada beast ke ataupun mana-mana haiwan ke untuk test dia punya clinical ke?
No, not yet. It is still in vitro study.
Alright, okay, I see. So guys, ada question lagi tak?
Any clinical questions like CT scan in the hospital?
Okay.
Because I am more familiarized with clinical settings. So this research and technical settings, this is my first time. Because I do fast track PhD, so I don't have master's degree. So that's why the progress is really slow for me. Because I have need a lot of effort to really understand a theory.
It's okay. It's okay, lambat tak apa. Janji ada progress.
Yeah, that's right.
Biar lambat asalkan kita selamat. Okay guys, ada question lagi tak? Before we end this sharing session. Bukan senang ni medical radiation untuk ada di sharing session ni, selalu jarang sangat nampak student from medical radiation program untuk berada di sharing session mana-mana pun. So guys, any question?
Any question like as a patient or something, you can ask me.
Tak ada dah. Tak ada dah.
Okay.
Okay, that's all from today. Miss Ami. Wait, ada satu lagi. Okay, from Husna Azizul.
Mind sharing your HFOB culture techniques or tips since I'll be using HFOB, but some say it is quite difficult to grow. I probably just use the same method as everyone else using DMEM but what I usually do for the amount of fetal bovine serum (FBS) is that I use 10%, not 5%, for reviving the cells and for culturing the cells. So maybe that could help in HFOB culturing. And any other tips is I feel like I do the same technique like other people, like DMEM and FPS with supplemented with 1% of penicillin streptomycin. I think that's it. You can try using 10% of FPS and see if it grows. For now, I feel like MDA MB231 is more difficult to grow than HFOB actually. That is from my experience. MDA is a human carcinoma cell of the breast. So yeah. Any other questions? Okay, there's one more. Out of many normal cells, why did you choose osteoblasts? I wanted to choose normal breast cells, but it is not available to my it's not avail the availability is um unfortunately not for me. So I use another type of normal cells, which is HFOB. I tried search for other normal cells, which there's one cell that I use, and NIH cells, but I could not revive it, so I continue with HFOB. Any other questions?
So, ada lagi soalan? Topik sangat menarik je pasal bismuth particle. So, aside of that, ada tak kisah apa-apa lagi pasal bismuth particle ni yang semua orang tak tahu?
That it is has healing properties, like I said. And then actually there's bismuth is so hard to stabilize. Like you have to pair it with something else. But for me, I'm using pure bismuth, which actually could turn into bismuth oxide with the presence of water. So most research that I see, they use bismuth oxide because pure bismuth cannot be stabilized on its own. So right now, if I am using bismuth, this bismuth pure, I cannot use it with water because it will oxidize. So that is one challenge of using bismuth pure. So that is one thing that maybe you guys don't know.
So any question, guys? Sebab supposedly this sharing session is for 2 hours. So tapi kita expect lah benda ni habis awal.
Yeah, yes.
So we are waiting for your question, guys. Please drop the questions.
Anything else?
I think that's all for today. Probably we can end this sharing session.
Okay.
So anything
Thanks
to
for
add
having
on,
me.
Amirah Jamil?
That's it. Thanks for having me today.
Thank you juga. Okay, bye. We can end the
Bye.
broadcast. Bye.
Alright.
See you later.
Bye.